I want to thank the Alliance for Academic Internal Medicine. As I reviewed the list of prior awardees, I am honored to be part of this list. I'm not the typical program director. I served for 9 years at the Massachusetts General Hospital Department of Medicine. I'm also an NIH basic science investigator. And so when I approached this job, I really wanted to foster intellectual curiosity amongst my residents, not just those that were going to engage in research for the rest of their lives, but really to ensure that all of our trainees, whether they were going to engage in primary care or whether they were going to do global health or they were going to become a subspecialist, really took the scientific method to approaching patient care. And we did that through a couple different innovative programs. Two programs that I'd like to highlight. One of them is the Pathways program, where we put the brakes on the busy clinical schedules that so many of our residents go through as the rigorous part of their training, and allowed them to focus on a single patient. This patient oftentimes eluded diagnosis or whose treatment plan or treatment response was very different than what we expected. And we allowed them to focus on that one patient for 2 weeks, really trying to understand what are the undiscovered biology that is relevant to that particular case. And it really allowed those residents, after they spent those 2 weeks, to really start to understand when we see patients that don't really fit neatly in a lot of our boxes, how to approach a diagnosis and how to collaborate with scientists as well as other individuals to ensure that we engage in the best care possible. The second one was to really partner with the NIH to ensure that we gave residents who may not have had extensive opportunities to do research the opportunity to do 1 year of research in a highly mentored environment. And using the STAR grants that were issued through the National Institutes of Health, we were able to take up to 7 residents every year to give them 1 year to really focus on research and try to decide whether this was an area that they wanted to devote some of their professional time. Well, first and foremost, I am indebted to all of my residents and all of my fellows that I've worked with, not only for the 9 years that I served as a program director, but for really the entire of my career. It is their questions. It is their opportunity to really extend and push us to become outstanding teachers that really made me continue to work as hard as I can to ensure that we gave them the proper environment by which they could explore as well as train to become outstanding physicians. I worked with an incredible group of chief residents, too numerous to name, but really some individuals who are truly dedicated to paying back to our residency program, who have given a year of their time in devotion of teaching and to our residents. And then finally, there's a number of different faculty that I'd like to mention by name: Josh Zipperstein, Meredale Baggett, Jess Seidman, Kathleen Finn, Alberto Puig, as well as Josh Metley and Katrina Armstrong. All of those individuals shared our vision of fostering intellectual curiosity amongst our residents, and I couldn't have asked for better partners. And in speaking of partners, our administrator, Gabby Mills, was just an incredible person. We dreamed and she made that happen.